Hello friends, this is Dr.Abhay Verma once again welcoming you to my channel over here. Today I have one more analysis to show. This time it is in English. I am just talking to you. Rest of the time I talk in Russian on my Russian channel. But you can always see all my testimonials, the previous testimonials and whatever it is going on from the past 3-4 years on my Russian channel. This is about a girl, my personal patient who comes from Uzbekistan. Yes, the people who are coming from Uzbekistan on a regular basis to Delhi, India for transplantation of liver. And the doctors in Uzbekistan could not even put the child, she's 19 years old, put the child on, let's say, a diagnosis. They left her to die. 19-year-old girl, very young patient. She's completely yellow, eyes are yellow, nails are yellow, the skin is yellow, the urine is yellow, everything is yellow. Whoa! And they couldn't even give a diagnosis. The diagnosis is 3 words: biliary liver cirrhosis, or the compensated form of biliary liver cirrhosis. That's the diagnosis I gave here. And her father contacted me in January this year. And he said, Dr.Abhay, I just saw your all the videos from the past, more than 50 videos I'm having on my Russian channel. And he said, can you help with my child? I love her so much. There's no problem, sir. If I can really manage, I will do it. And we started the dealing. I'm showing a few analyses of how the status was. The status being that the patient, I will call, she was having a very high volume of ascites, that's fluid in the peritoneum cavity, a lot of fluid. And I said if it's more than 2 liters, it needs to be drained surgically. But it was around 1,500 to 2,000 milliliter. I said, okay, then we can check with the medicines. And we started the dealing. There was ALT, AST, all the enzymes were very high. Bilirubin, direct, indirect, and everywhere it was very, very high. Gamma glutamine, transpeptidase, all the enzymes were very high. They sent me a few analyses. I'm going to share with you the results, the typical, magical treatment which I possess, which I acclaim. And no other doctor, maybe there are doctors there, but very less doctors in the world who can acclaim that liver can perfectly be regenerated, no matter what. It can be regenerated. We studied it in the 9th classes of biology. The liver has the nature of being regeneration, like a starfish or a lizard's tail. They have the power of regeneration. That's the game. I started with my treatment. Here are a few analyses I'll show you. They are in Uzbek language. It's all about the ALT, AST. They're very high. Doesn't matter. Let's go further. That's about the ultrasound, and it's also doesn't matter. Let's go further. Till that time, there was the diagnosis written here that there's a lot of fluid in the peritoneal cavity and everything there. And on the she started treatment around the 7th of February 2023. And her mom, as I said, that please get the analysis done not later than 3 months. But her mom, she was very afraid that the child must be undertaken. She took the analysis on the 17th of March. Today we have the 20th of March. 17th of March analysis. It's showing here, 17th of March, the patient, Rano, her name is Rano, and 17th of March, and it says, if somebody understands Russian, they can see it, that is, there is no fluid in the peritoneum cavity any further. No fluid in the cavity any further. And the conclusion remains exocrine chronic hepatitis. It means exocrine chronic hepatitis with changes to liver cirrhosis. And they have a stone in the gallbladder. That's a different thing. That has nothing to do with liver cirrhosis and this thing. But the fact is, in around 35-40 days, I got rid of 2 liters of water, which was, and she's been suffering for the past 10-12 years. What? Past 10-12 years. I got rid of it. Her Fibroscan. Let's talk about the Fibroscan, the basic analysis. That was the last Fibroscan they did. That was on the 19th of October 2022. The same patient, Reno, if you can see her name, Reno, her Fibroscan was 39.9, and that the date was, I will show you here, I wrote here also. The date was, let's hold it, 19/10/2022. What? The Fibroscan was 39.7. And they started the treatment in February. It means that by that time, the Fibroscan must have been higher than 45 or around 50. Around 50. I started the treatment, said the first results you will gain in 5 days, at least some sort of improvement. Around 25 days, you will get first positive treatment. Her mother, again, could not stand 25 days period. She said, no, I need to know if your treatment is really right, doctor, as much as you claim. That was the date, was the 6th of March. 6th of March. The same patient, Reno. You will write her name, Reno. The date is the 6th of March. It's a single date. 6/03/2023. Fibroscan has fallen to 33.4. That's the magic. That's the magic. 25 days, not a single doctor. Maybe USA, Germany, Israel, Russia, Uzbekistan, even in India, all the doctors, they say, it is not possible. Don't go for any sort of treatment. You only have to undertake liver transplantation. This is all very wrong. All very wrong. I'll say it again, all very wrong. This is the treatment. The treatment is right here, and she's still undergoing treatment. I say the treatment goes from 5 to 7 months, from 5 months and further, depending upon the patient and the complications along with the liver cirrhosis, whatever they are having. It takes around from 5 to 7 months, maybe 12 months, maybe someone takes around 2 years. But it can all be relinquished to the fact that without any liver transplantation. That's my point of telling you. Please check this analysis. This is here. Today is 20th of March. And you can check all my other testimonials analysis on my Russian channel, where I speak in Russian. That's what. And if any doctor is trying to telling you that it is not possible to tell him that he is not giving you full information about whatever it is, maybe essential capsules, maybe phosphoglyph capsules, maybe Geptral capsules, maybe Gepamer's cyto powder. They won't help. They are liver protective. They don't treat liver. Treating liver is here with me. Please contact me on the number of my Whatsapp. And if you like my video, please do like it and share it with your friends. And do subscribe my channel so that everybody in the world should know that it is possible. There is no way out. There's only one. $50,000 to $90,000 to be paid for any liver transplantation. That's not real. It's not real. It's for everyone. Thank you so much, whoever is seeing me. Till new features.